This conference will now be recorded.
Okay, hi everyone. Maybe we'll wait just 1 minute in case there's any stragglers, but let me see if I can just move some of this stuff out of the way as I get ready. Okay. Well, good morning, everyone. I know it's Monday morning in December, so I hope some people have some more energy than me this morning. But today we're going to be talking about the qualitative interviews for Project E, the goal of which is to understand people's expectations for treatment, and then later on a repeat interview for satisfaction with treatment, as well as a discussion with the participant about things that were helpful and things that were not so helpful. And basically the idea behind this is to enable a mixed methods approach in LURN 2, where we combine some qualitative data with quantitative data. I'm going to be sort of the person running through the slides, but I just want to acknowledge that all of the training materials were created in collaboration with Catherine and Melissa and Michelle, and they're going to be helping out with the training today as well. And the DCC emailed, I think, all the materials for today's training, and so I'm going to be going over everything, but you should all have that in your inboxes as well. So let's see. So our objectives of Project E are to determine what is most important to patients with urinary urgency over the course of treatment. So this is really a patient-centered method where we talk directly to the patient and ask them, what is most important. This is a methodology that's consistent with what the FDA looks for in terms of understanding patient-reported outcomes. And as many of you know, an important aspect of the LURN research has been to create some additional questionnaires to use with this patient population. We also want to use the interviews to have an opportunity to better understand health-related concerns and the symptoms of urinary urgency, as well as their impact on patients. That's going to be similar to some of the things that we did in LURN 1. But one thing that's going to be a little bit different from LURN 1 is that we have a part of the interview that's again is about what patients expect from treatment. And then later on, after the patient has received some treatment, we'll talk to them about how treatment went. And we hope to use the post-treatment interviews to highlight some differences among patients to identify things that determine successful versus unsuccessful outcomes. By the way, as I'm talking, if anyone has any questions, please feel free to just chime in or just mention something in the chat. I don't see the chat window on the screen right now, but I'm assuming if someone chats a message, I'll see it pop up. So the study population for Project E is basically the same as for the parent protocol. It's going to be patients with urinary urgency. They're enrolled into the parent study. We're looking to enroll a minimum of 64 participants. And these are all going to be patients, just like in the LURN parent protocol, that are seeking care for urinary urgency or urge urinary incontinence. In terms of the eligibility criteria, again, we all know from the parent protocol that these are going to be people presenting for evaluation and or treatment. The assumption of this, and we've talked with a lot of the clinicians about this, is that every patient is going to have some plan for treatment, even if the plan is something like watchful waiting or active surveillance. All the patients will be adults and will be able to communicate in English and will obviously provide informed consent to participate. So in terms of what each site is going to be asked to do, we'd like each site to do around 11 interviews with a minimum of 5 men and 5 women per site. And so this will allow us to sort of roughly stratify the composition of the sample. On the next slide, I'm going to go over some race and ethnicity targets. So that's not something that we're stratifying for, but we are going to set some minimum numbers that the DCC will monitor to make sure that we have some diversity in the sample at the end of the study. And also, because this is a qualitative study where we want to have some ongoing discussions about things that come up in the interviews and also allow the interviewers to receive some supervision from Catherine Flynn and myself, We're just asking each site to do 1 to 2 participants per week. So hopefully this will be something that can be fit into the workflow at each site. So this is just a schematic of the stratification plan from the protocol. So we're planning to have an equal number of men and women. Within that, it will be stratified in accord with patients with and without incontinence. Within that, we'd like half of the patients to have received some treatment in the past and half to be treatment naive. And so there will be eight participants per cell. Now we're not expecting this stratification to manifest within each site. This is kind of the plan for the overall study. And again, the DCC will be monitoring this. And when we've hit targets in certain cells, the DCC can communicate to the sites about what kinds of patients we've hit our targets with and what kinds of patients we still need to recruit. Overall, for the sample, we'd like to have at least 8 participants with an education less than a 4-year college degree, 8 participants who identify as a non-white race, and 8 participants who have a Hispanic or Latino or Latina ethnicity identity. If there is a non-binary or transgender participant, they will also be welcome to participate. They just won't be counted in terms of these targets, and so they would just be kind of added to the overall sample. So we might have a sample size slightly larger than 64 in that case. So some logistical things to go over before the interview. I don't know if everyone on this call is familiar with Zoom. We use it at Northwestern for basically everything, and so like a lot of people right now, we're totally zoomed out from being on Zoom all day. But I don't know if that's the case at every site, and so we have prepared some materials to sort of go over the logistics of how to set this up with the participants. So you all would have received in your email some instructions for how to set up the Zoom invitation for the participant. There's also some information that the participant receives in order to know how to call into the meeting. And we're going to be asking the participants to use their phone to call in because we don't need any video to be recorded as part of this. It's only the audio that we're interested in. So just to go over this, and Michelle and Melissa, please chime in if I misspeak about anything, because I know it was you two that really put these materials together. But within Zoom, when you set up the meeting, you're able to toggle the recording settings such that the interview will be recorded onto the cloud. Now, there is an option in Zoom to record it onto your local machine, but recording it to the cloud is the only way that you can do it audio only. And because we don't want to have to deal with any additional IRB issues or have the person accidentally be recorded on their video, we're sort of recommending that it be done this way. And when you schedule the meeting within Zoom, it will be set up to automatically begin the recording. And again, this is all explained in the instructions that you received by email. And this is, of course, something that the participant is going to be consenting to as well. So on your screen, when you're doing the interview through your computer, because you'll be at your computer, the participant will be on their phone, there will be an icon that says that the interview is recording, but if not, there is a big red record button within Zoom that you can push to initiate the recording. And after the interview, when you end your meeting, the recording is going to be saved to the cloud and emailed to you, so you have a copy. Now, we are going to be asking people to keep track of what's on the cloud, and after it's been uploaded to the DCC, there's no longer going to be a reason for it to be on the cloud, and so later on, you'll be asked to delete that. So we have some instructions on how to do that as well. I'm going to go through this a little bit quickly because I don't think this is going to be hard for people, and I think it's going to be best that people just run through this process themselves in order to learn the steps with a test interview. And we are going to be asking all of you to do kind of a mock interview with each other, and so you can sort of go through these steps on your own. You will be able to upload the recording to the DCC SharePoint folder. And after you do that again, you can delete it from the Zoom cloud. So in terms of the interviewing methods, there's different ways that qualitative data are collected in qualitative and mixed methods research. There's focus groups as well as individual interviews. For this particular study, we're going to be using one-on-one interviews, one that's done at baseline and one that's done later on at a post-treatment time point. And the interview guide contains a combination of open and closed-ended questions. The reasoning for doing open-ended questions is it's a way to elicit some information from the patient in a way that's non-leading. So the idea is to get as much information as possible from the patient in his or her own words without being contaminated by our preconceived notions about what we think they're dealing with. But we do have some directed closed-ended probes as well to make sure that there's some information that we get that we don't want to miss. So at baseline, we're going to be asking about symptoms, how they're experienced, when they began in terms of their onset, any non-neurologic factors that modulate them, such as anxiety, stress, trauma. It could be dietary factors. It can be different things for different patients, as well as any kind of adaptive or care-seeking behaviors that the patient engages in. And then most importantly, some expectations for treatment. And then in the follow-up interview, we're going to be interested in changes in symptoms, as well as what the experience in treatment was like for the patient, any side effects that they experienced, any difficulties that they had in adhering to the treatments, any kind of meaningful changes that was experienced, what was important to the patient in terms of how much they got better and basically how overall satisfied they were with treatment. So in terms of preparing for the interview, I know that many of you are working at home during the pandemic, and myself included. But to the extent possible, try to have a private, quiet, comfortable place to conduct the interview, so that you at least try to minimize any kind of background noise when doing the interview. And make sure that you have all the materials handy, including the interview guide. If you have any issues while you're doing the interview, Catherine and I have our mobile numbers on here. You can always get in touch with us if something goes wrong. And we are going to be having a weekly meeting about these interviews just to discuss how things are going, any kind of project logistics, anything that comes up in the course of doing the interviews that's interesting from the patients. And so just be prepared to discuss those things after the interviews. And so this is also a way for us to refine our procedures and make sure that we do things as effectively as possible. In terms of other materials that you'll need to have access to Zoom and some facility with it. You'll need to be at your computer. You'll need to have the qualitative interview guide, and then any payment issues, payment forms or procedures at your site. And I know that those are site specific. So in this next part of the training, I'm just going to go over some sort of general tips on how to conduct the interviews, and then we're actually going to listen to a mock interview, and then after that, later on in the training, we'll do some role playing. The first thing I wanted to mention is just professionalism. So with patients, they're often suffering from different things. They may have a lot to talk about in terms of their own urinary symptoms, as well as other things going on in their life. It's a good idea as much as possible to try to sort of keep on task and use time efficiently to model good behavior to the participant. This is not something that's usually a problem, but you just want to make sure that you yourself don't get too sidetracked talking about things that are irrelevant, because it's just going to add to the time necessary to do the interview, and it's also going to potentially confuse the participant about what the time is being used for. You should also inform the interviewee that you're going to be taking notes during the interview, especially because you're going to be typing the notes at your computer, and so they may hear the sound from the keyboard. And so just let them know that, so that they don't think that you're multitasking or being distracted yourself. Keep in mind, and I know that many of you who have been involved in clinical research for a long time are aware that the patients are dealing with a lot of things that can be very sensitive and emotionally upsetting. Just keep in mind that for these interviews, there's a lot of things that can come up that are potentially embarrassing or sensitive to the participant. And so try to be as patient and empathic and respectful as possible, as opposed to sort of overreacting to something that the person mentions. So for example, if the participant mentions something about leaking some urine in a public place, it wouldn't be a good idea to say something like, "Oh my God, that must have been terrible," because you don't want to sort of send the person a message that they have something to be ashamed of or something to be embarrassed about. Your job is basically to be a neutral listener trying to document as much as possible what the patient's experience has been like. And usually people are very appreciative to have some time to talk to someone about some of these issues. Having said that, you don't have to take time in the interview to sort of try to give the person some kind of therapy or make them feel better. You want to try to avoid as much as possible any kind of judgmental language. And by communicating with a person directly and respectfully, it's a good way to sort of maintain that focus. And along those lines, you don't need to give the person any advice about what to do. So again, if the person was talking about leaking some urine, you wouldn't necessarily say, "Oh, for that you might try wearing a pad the next time you go out." At the end of the interview, the participants may have some questions about things, and one of the things you can do is always have them talk to their doctor about it more carefully. And obviously, their doctors are all going to be LURN investigators that we have relationships with, and so we can always put the doctors on alert about any kind of issues that the patient is dealing with that they might need to follow up on clinically. And so I just want to make clear that that's not something that you would want to do during the interview itself. So some examples of non-judgmental responses would just be, saying mm-hmm or uh-huh as the person is talking, to kind of let them know that you're there. We've all been on long phone calls where sometimes an awkward silence makes a person think that the other person got disconnected or they're not listening. So sometimes it's good to use some just verbal reminders that you're still there. You can say things like, "Oh, I see," or "Okay," or "Thank you for sharing that." And again, you just want to avoid any kind of judgmental language like, "Oh, really? That must be really difficult," or "Wow." I know that many of you have a lot of experience working in clinical research, and so I don't think any of this is going to be an issue. But in my experience and in Catherine's experience, training people to do interviews and observing other people doing interviews, sometimes there can be a tendency for that, and so we just want to try to avoid that as much as possible. One thing that's really important about these interviews is to use listening skills. And sometimes what listening means is remaining silent and letting the other person talk. It sounds very simple in theory, but it can be more difficult to put into practice. And for me, the way that I experience this sometimes is sort of like, if I have something in my head that I want to say, but my job is to be listening, I need to basically restrain myself and let the other person talk until it's kind of my turn. And so that's basically going to be your jobs when doing this interview. So one of the ways that you can facilitate this is to ask one question at a time. The interview guide has a lot of questions in it, and as you're talking with the person, you may have multiple questions in your mind that you want to ask, but you want to train yourself into getting into the habit of just asking one question at a time. So for example, if you went to the doctor and a doctor said to you, do you drink alcohol or use any drugs, or how much do you exercise? It's kind of a lot of information to process, and the participant might not know which thing to respond to. And so one way that you can make it easier for them is just to ask one thing at a time. Along these lines, it's okay to be silent while the participant is formulating their response. And so one of the things that this means for you as the interviewer is that you may need to sit with some silence for a bit rather than abruptly interrupting the silence. And so this might involve just being silent for 5 to 10 seconds while the person is thinking. Again, there's going to be some judgment here, and it can vary from person to person. But when we ask people about sensitive medical issues, it's not always the case that they answer right away, and so sometimes they need some time. Some useful things that can be helpful in terms of getting more information about something is you can always say to a person, "Tell me more about that." And so that can be a way to prompt them to give some more detail or give some more information about something that they're discussing. You can also say something like, "How do you mean that?" or "Can you tell me what you mean by that?" Sometimes participants use words or phrases that maybe we don't understand, and so it's always okay for us to ask them to explain what they mean. After a person tells you something, you can say anything else as a way to sort of prompt for some more information as well. So these are all ways that are very neutral, very non-judgmental, but a way to sort of prompt the person to give you a little more information. There may be times when it's necessary to interrupt someone if they've gone really off topic, or they're repeating a lot of information that they've already told you, or basically just off task. I would do it judiciously and really try to reserve it for times when you're trying to refocus the person to sort of get back to the interview. I know that all of you as coordinators are really familiar with the study. Sometimes people will ask questions about the study during the interview, and so be prepared to do that. I would save that to the end of the interview, again, just to sort of keep the person on task. If necessary, you can allow the person to take breaks. We don't think that the interview should take more than 60 minutes at most. And in the run-throughs that we've done, they've taken about 20 minutes. So the person may actually not need a break, but if they do need a break, it's of course okay for them to take a break, and you would just pause things and resume when the person is ready. If for some reason an interview becomes unusually long, you can use your judgment about when to cut things off. Again, we don't think that it's going to take more than an hour at the very most to do these interviews. But if for some reason a person was extremely talkative or having difficulty focusing, and you just feel like you're having trouble actually getting the interview done, there are some people that maybe just are not going to be able to finish the interview. And if you need to cut it off, you can cut it off. We just want to make sure that all the interviewers know that they're kind of empowered to make some judgment calls. And at the end of the interview, it's a good idea to thank the person for their time and express some gratitude for the contributions that they're making to the study, and especially because this is a way for us to hear directly from the patients about what they're going through, in addition to all of the questionnaire data that we collect and specimen data we collect. And so this is something that we really very much appreciate, and we want all the people in the LURN study to feel like that they're kind of contributing to something important. So in terms of your responsibilities as interviewers, one thing to be clear about it is like the main thing that we're trying to get from these interviews, in addition to the content of the data, is we want to get a good transcript of the interview that we can analyze. So make sure that you're familiar with the processes so that you can get a good recording of the interview. Try to take some good notes so that we have some things to discuss at our weekly meetings. Although all the interviews are going to be recorded and transcribed, there are times when the recording maybe is missing something, or there was a part of the interview that was difficult to understand. And so sometimes taking some notes is a way for you to sort of remember what the interview was about. And as we discuss these interviews from week to week, it's going to be a way for us to get a sense of the kinds of things that are coming up during the interview. I know on the slide it says take legible notes, but that actually doesn't apply here because we're not going to be taking any handwritten notes. When it comes time to do the follow-up interviews after the person has received some treatment, you should review the first interview to see what the person's symptoms and expectations were, so that you're familiar with that going into the second interview. And just as a final reminder, these are, of course, clinical research data, so they're sensitive and confidential, and please treat them as such. Don't discuss anything that comes up in the interviews outside of the context of LURN research, and make sure that all the materials associated with the interview are managed carefully so that they're not leaked or breached in any way. If there's anything that comes up over the course of doing the interviews, again, we're going to have some weekly check-in supervision meetings where you'll have an opportunity to just discuss anything in terms of logistics or clinical issues that came up during the interview. And again, you can contact Catherine or myself at any time. Try to transfer the data to the DCC SharePoint site as soon as possible so that you don't forget to do it, and we have recordings go on walkabout. And if there's any logistical issues that come up, like patients being upset by certain questions or complaining that the interview doesn't make sense or is taking too long, please let us know about that so that we can make adjustments. Some other issues, as you're talking with a person, refrain from using their name or any other identifying information, because we want the interview recording to be confidential to the extent possible. Sometimes people will slip up, and that's not a tragedy if that happens. It just means that we'll have to go in and edit the audio file to edit out any kind of confidential information that's in there. That's not hard. It's not hard to do, but it's better to sort of prevent it. In case any participants need any explanation of terminology, we just wanted to remind people that there is a glossary from the International Continence Society that defines certain terms that come up. And so if it's helpful, you can always refer to that to explain to patients what certain terms mean. These are, for the most part, going to be patients who are diagnosed with a condition and seeing a specialist at least for the first time, but they may be coming in for follow-ups as well. So many of the patients will be familiar with a lot of this terminology. If a person has some difficulty answering certain questions, like when their symptoms began, it may be that their memory has faded. And so you can encourage them to answer, but just recognize that there's going to be limits, and there may be some questions that people are just unable to answer. There may be also cases where people are unwilling to answer certain questions for whatever reason, and that's also their right. And so if a person chooses to skip some questions in the interviews, that's not a problem. And just keep track of how long the interviews take. I mean, just kind of unofficially, if in case they end up going for too long. I don't think that's going to be an issue, but we sort of never know until we really get into this with some real patients. You should be familiar with the interview guide, and we're going to go over some of that today. And some of you have seen that already from reviewing the protocol and the appendices. It's really important to understand why we're asking certain questions and why we're doing the interviews in order to frame the questions. So the interview guide is kind of a list of questions, but it's important for people to understand that we're using the interview guide as a way to sort of stimulate some discussion from the participants. And so you want to sort of get into the mindset of not just asking a question and then moving on. Before you move on, you just want to ask yourself if you have the information that you need before you move on. And there may be some cases where you might want to use one of those phrases that we discussed earlier, like, can you tell me more about that? Or can you elaborate on what you just said? And so we just ask that people have some understanding about why we're doing Project E. And again, we are going to have these supervision meetings, and one way that you can hone your own interviewing skills is by actively participating. And sometimes what we do in those meetings is if there's some issue that's difficult to interview about, we might even use some of that time to do some role playing like we're going to do today. So what we're going to do next is we actually have a recording of kind of a mock interview that we'd like everyone to listen to and take some notes about. One of the things that you received in your email was kind of like a scoring guide about an interview. And so if you like, you can look at that and sort of follow along to sort of see what the interviewer did well and did not so well. And then we'll have some discussion about that. But before we do that, I wanted to pause for a moment and ask if anyone has any questions.
Jamie, what if a participant is in clinic, has been in clinic before, or a new patient in clinic, and they start their treatment before you do that first interview? Does that exclude them? Because that's a concern of mine, that some of these participants may not want to wait to start their new treatment.
Yeah, I don't think that we would ask someone to wait to start their treatment for this.
Well, I thought that's what we were supposed to do, but maybe not.
Well,
I thought it was.
I guess my question would be, if the only thing that would cause them to wait for the treatment is this, I mean, it does seem like a big thing to ask, but I know that we talked with the clinicians about this, and for the most part, it sounded like it was going to be feasible for the interviews to happen before the treatment began, especially because we're only asking sites to do 1 or 2 per week.
Right.
So I guess my question would be, from the coordinator's perspective, is that going to be a problem to do 1 or 2 of these a week with someone before they start a treatment, or no?
Well, for us, it just depends on how it actually goes. There's a lot of sub-studies that need to be done before treatment starts, to the best of our ability. So it's just figuring out all the logistics and then getting those down. And I don't know, what do the other girls think about that?
Yeah, I guess why people are pondering that, I guess I would say, so let's say the person is going to get a medication, maybe some alpha blockers or something. Maybe we would try to see if we can schedule the interview for that person quickly before they get the medication. I think if I remember correctly from talking with the clinicians, it wasn't like the medications even take effect right away. And if there's other studies that need to be done before the person starts treatment, it doesn't seem like this would be unfeasible, but I guess I would, yeah, I guess I would sort of.
Will there be a place to document what treatment they're going to be starting and the date of starting? Would that be helpful to you?
I think so, and maybe some from the DCC can weigh in. I mean, I'm assuming that we're capturing that somewhere. We don't have that as part of. Well, I guess we have that as part of the interview guide, in the sense that we ask the person what their expectations are about treatment. And so it's going to be captured qualitatively somewhat as part of the interview. But at the DCC, are we also capturing treatment categories somehow? Or can someone just refresh me on that?
I'm sorry, Jamie, can you repeat that?
Yeah, I guess the question is, are we capturing treatment somewhere in the LURN protocol? I thought we were.
Yeah.
Yeah, okay.
Yeah.
Yeah, so
that's Project A.
Yeah, okay. Any other questions before we listen to the mock interview?
This is Catherine Flynn. Can you hear me?
Yeah.
Yeah, I just wanted to make one comment about if anything comes up. Jamie put our cell phones on the screen, and I just wanted to note, like, especially if you text me, I am usually pretty quick. So very happy to answer kind of questions, try to answer those on the fly. You know, recognizing that we have this, you know, kind of limited time with our patients for this piece, and it's a little bit different than many of the other components of the overall study. So please feel very free to use my cell to ask questions if you need to.
Yeah, thanks, Catherine. And the same goes for me. It's really not a bother if people call or text me, and I will try to get back quickly as well. Okay, well, I'm going to see if I can play the recording for us. I've never done this in GoToMeeting before, so hopefully this is going to work. So when I start to play the interview, if people could just let me know whether they can hear it. Because if not, I'll have to see if I can adjust something, but I'm going to give this a try and see if it works.
Hi, can I please speak to Melissa Marquez?
Can people hear that?
Hi, this is she.
Hi, Melissa. This is Michelle calling from Northwestern with the LURN 2 research study. I'm calling because now is the time we scheduled to do your interview. Does this time still work for you?
Yeah, this works.
Okay, great, thanks. So as a reminder, this interview will be recorded. I will let you know when the recording begins. I will also be taking some notes while you're talking, so you may hear me typing in the background. If you're uncomfortable answering any of the questions that we go through, please say skip, and we can move on to the next question. Any questions before I start the recording?
Will this information have my name attached to it? You said my name at the beginning.
Yes, I did say your name at the beginning to verify your identity. The recording has not started yet. As soon as I started, I will try not to use your name. However, if I do accidentally say your name while it is recording, I'll go back and delete that from the recording later. Any other questions I can answer?
No, that makes sense. How long will this take?
The interview should take about an hour to complete. At most, I will say it'll take about an hour and a half.
Okay, great. Let's start then.
Great, I'll start the recording now. All right, so I will be interviewing today about your experiences with urinary urgency. Urinary urgency is defined as a sudden, compelling desire to pass urine, which is difficult to defer. There are no right or wrong answers to these questions. We just want to hear about your thoughts, opinions, and experiences. To start off, tell me about your experiences with urinary urgency. This can include any of your symptoms, concerns you have about the symptoms, or any other things that may affect your daily activities or quality of life.
My main issue is I really just have to use the bathroom a lot. It's very disruptive to my life. I feel like I use the bathroom constantly and wake up several times every night to go. Every once in a while, it will be very uncomfortable when I have to urinate. Sometimes I'm afraid to even go to things like the movies because I'll miss most of it having to go to the bathroom. My daughter graduated last year and I was still worried about having to go to the bathroom during the ceremony and not being able to get out of the stadium seats. It was really stressful. Sometimes I'll feel like I have to go to the bathroom, but when I get there, I don't really have to go. It just seems like a waste of time.
Okay, and can you tell me more about how often you urinate on a daily basis?
Maybe like 9 or 10 times a day, and sometimes at least 2 every night.
Okay, wow, that is a lot. Is there anything else you would like to add about your experience with urinary urgency?
No, I think that's it.
Okay, we'll move on to the next question. So how would you describe your symptoms?
Annoying.
Okay, can you tell me more about that? What makes them annoying?
I mean, they're just annoying and uncomfortable. I'm worried about leaking and it being noticeable. It all happens very fast. And if I don't know where a bathroom is, it can be bad.
Okay, great example. How would you describe the feelings or sensations you have before you urinate?
It's just fast. It's like all of a sudden I have to go to the bathroom. No time to really think about it. There's a lot of pressure and then anxiety, and I have to go to the bathroom right then.
Okay, do those sensations always happen suddenly or do they develop over time?
Almost always suddenly.
Okay, and do those sensations come and go or are they constant?
They come and go. It's only when I have to pee that I notice them.
Okay, is there anything that causes your feelings of urgency?
Sometimes when I'm nervous, I feel like I have to pee more often. If I drink a lot of water or something that also makes it worse, or coffee, I drink a lot of coffee. I try not to drink too much now because I don't want to have to pee so often.
Okay, so there are certain times when you notice these feelings of urgency.
They mostly happen during the day, but like I said, a few times at night too. During the day, I'm just waiting for them to happen. It usually happens pretty quickly after I drink my morning coffee or if I drink a lot of water after a workout or something.
Okay, yeah, that makes sense. Drinking a lot of fluids can cause you to have to go to the bathroom more often. Okay, so next I'd like to ask you about your history of your symptoms. So what was the first symptom that you experienced?
I'm not sure. Probably just having to go to the bathroom more than I used to. I thought it was just from getting older.
Okay, so increased frequency. And when did that first begin?
I'm trying to remember. It was so long ago. I don't know. Maybe like 10 years ago.
Okay, thank you. And what about your other symptoms, like having to use the bathroom quickly? When did that begin?
Probably around the same time. It was normal, and then these symptoms started to come on right after one another.
Okay, can you remember a time when you did not have urinary urgency?
Barely. It just feels like forever ago.
How long ago would you say it was? And what was different then versus now?
Well, maybe 10 years ago or so.
Okay, thank you. And how did you feel different then versus now?
Well, I just feel like I was able to live, you know? I wasn't worried about having to use the bathroom or always knowing where a bathroom is. I didn't have to leave events suddenly or to go to the bathroom. It was nice. I didn't have anything controlling my life like I do now.
Okay, thank you for sharing that with me. Did you ever experience urinary urgency symptoms back then?
Maybe a few times, but I would say not more than anyone else. I was able to hold my pee if I didn't have access to the bathroom. Now I can't do that very long.
Okay, did the urges develop suddenly back then or was it gradual?
Probably more gradual than it is now. I can see it coming, if you know what I mean.
Okay, and what symptom bothers you the most now?
Probably how often I have to go to the bathroom.
And what is it about the frequency of having to urinate that bothers you the most?
It's just inconvenient. As I've said, I miss out on things, or it's embarrassing to have to get up to go to the bathroom so often.
Okay, and how much does that interfere with your life?
A lot.
Okay, and how does it interfere with your life?
I don't always do things that I want to because I want to be close to the bathroom. People I don't know will sometimes ask me where I'm going all the time, and it's just embarrassing.
Okay, thank you for sharing that. And how have your symptoms changed over time?
They just seem to get worse and worse as I get older.
Okay, what things make your symptoms worse?
Drinking lots of water, coffee, or whatever.
Okay, do you notice that one type of fluid affects your symptoms more than others?
I think coffee is the worst. Everything else is the same.
Okay, and do you ever drink alcohol?
Sometimes.
And does that make your symptoms worse?
Probably about the same as coffee.
Okay, so coffee and alcohol affect your symptoms the most?
Yes, I think so. Is that normal?
Well, everyone's symptoms are different. That's why we're doing these interviews, to learn more from people who have these symptoms. So I appreciate you sharing that with me. And is there anything else that makes your symptoms better?
Not really. If I just don't think about it, I think I probably use the bathroom less on days when I'm especially busy.
Okay, thank you. Are there any certain foods that affect your symptoms?
No.
Okay, so no foods affect your symptoms, correct?
Yes, that's correct.
Okay, thank you. Now, thinking about your emotional symptoms, how does your urgency affect you emotionally?
Well, like I said, it's just embarrassing, and I'm worried about it all the time.
Okay, so would you say it ever causes you stress or anxiety?
Yes, I guess you can call it that, but I prefer to say worry.
Okay, thank you. What thoughts go through your mind when you feel urge or urgency?
The first one is I need to find a bathroom as soon as possible. And after I actually have a bathroom and can go pee, I get worried that people I'm with will notice how often or how suddenly I have to go to the bathroom.
Okay, and how often do you have those thoughts?
Mostly when it happens around new people. My friends and family know what's going on with my house, but I don't always tell people. It's private.
Yes, okay. Do you ever avoid doing anything because of your urinary urgency?
I try not to. I don't want to miss out on things, but I worry about being trapped somewhere with no bathroom.
Okay, and how do you cope with those kinds of feelings?
Sometimes I'll try to remember to ask where the bathroom is when I first get somewhere, or I'll try to sit in an end seat at the movies or the theater or wherever so that I'm able to get up easily.
Okay, did anything happen to you before you first started having urgency?
What do you mean?
So has anything ever happened to you that was extremely upsetting or traumatic? Things like a serious accident or being physically or sexually assaulted?
I was in a physically abusive relationship for years, but that was like 20 years ago. So I don't think that's related.
Okay, so that was about 10 years before you noticed any symptoms?
Yeah,
Okay, thank you for sharing that. And were you abused or neglected as a child?
no.
Okay, thank you. What things do you do to improve or reduce your symptoms?
I mostly just try to drink less coffee and alcohol. Sometimes I try to drink less water, but I work out a lot, so I need to drink a lot of water.
Okay, and have you done anything else to reduce your symptoms in the past?
I tried some yoga, but I was too afraid of having to use the bathroom in the middle of class, so I stopped going.
Okay. Since you began experiencing symptoms, have you made any changes to your life to help you cope with these symptoms?
I mean, it sure takes up a lot of my mind thinking about these symptoms. I just try to know where the bathrooms are and be selective about the activities I do so I can feel comfortable.
And have you ever sought treatment for your symptoms?
My doctor told me to do physical therapy, and I tried that, but it was too uncomfortable, so I stopped.
Okay, and when did you try that?
Maybe like 5 years ago.
Okay, and how long did you go to the treatment sessions?
Only like 3 months.
Okay, was there anything that got in the way of you seeking other treatment?
The physical therapy just took a long time. It's like an hour each time, and they want you to come in almost every week or something like that. It's just too much.
Okay, did your doctor ever suggest any other treatments?
Yeah, but I'm not sure what I want to do yet.
Okay, can you tell me more about that?
She wants me to try some medications, but I can't even remember what they're called.
Okay, so what are your goals in seeking treatment for urgency?
I mean, I'd like to use the bathroom less, honestly.
Okay, and do you have any goals in seeking treatment for your urge to go to the bathroom?
I'd like to not feel like an emergency every time I have to use the bathroom.
Okay, anything else?
I'd like to be able to do my workouts without having to stop to use the bathroom.
And how often do you have to stop your workouts to use the bathroom?
It's usually like 2 to 3 times during an hour workout.
Okay, do you feel a strong urge to urinate each of the times you stop?
Yeah. I feel like I need to run to the bathroom each time to avoid leaking.
Okay, so if your doctor treats you for urgency, what do you think will happen?
I hope it helps improve my symptoms.
Okay, when you say you hope it helps improve your symptoms, how would you define relief of your symptoms?
I hope in the future I would be able to hold my urine for a normal amount of time and not have to run to the bathroom so often.
Okay, so you're hoping it would help you go to the bathroom less often and you would have less urge. Is that correct?
Yeah.
Okay, anything else?
I mean, that's the main thing.
Okay. Do you have any thoughts or ideas about how the doctor will treat your urgency?
She's mentioned a few things.
What has she mentioned?
Some medications, and if that doesn't work, possibly a surgery or something like that.
Okay. Do you know what medication or surgery?
Oh, no, I'd have to ask.
Okay, no worries. Is there anything else you would like the researchers to know that we have not covered today?
I guess it's just so disruptive to my life. I really want them to know that if there was a treatment that would work, it'd be really helpful.
Okay. Yeah, and the goal of this research is to better understand urgency so that we can find better ways of helping patients. So hopefully we'll be able to do that. And so on a
I'm on the
scale
phone. I'm on the phone. I'll be done in 2 more minutes. Sorry about that.
No, that's okay. And then on a scale of 0 to 10, with 0 being not important and 10 being extremely important, how disruptive to your life are your symptoms?
Probably a 10.
Okay, and is there anything else you'd like to add?
No.
Okay, well, thank you so much for your time and sharing all of that information with me. Have a good day.
Thank you. You too.
Okay, I think that's the end of the recording. So I want to give an extra special thanks to Michelle and Melissa for making that for us. And so we have a list of discussion points about the interview, but before we do that, I'm just curious from the trainees, what do people think of the interview? What were some things that were observed?
Well, of course, it's Mary again.
Hi, Mary.
Hi, Jamie. I thought they did an awesome job, number one. And number two, I heard the word wow one time, and I thought that was something we shouldn't use. And then it never went into whether that she leaked or not. Was that intentional or unintentional?
I
Because
think
a
it
lot
was, yeah, I mean, I think it's intentional in the sense that, you know, the first section of the interview is really open-ended where, you know, the person basically just articulates what's going on. So, I mean, you bring up an interesting issue. I mean, we could have had a section of the interview where we said, do you have this symptom? Do you have that symptom? Like, you know, do you also leak? Do you also get up at night? But you know, then it would become more of like an interview-based method of trying to sort of capture and maybe even quantify all of the symptoms.
Mhm.
So although that could be useful in some contexts, it's not as critical for this. But that's kind of a good point, that there may be some things that the person doesn't mention right away that could be relevant for sure.
Well, more on the participant side. You know, she alluded to it being very embarrassing, which I know urgency can be too, but sometimes it rolls over to leakage. And I didn't know if she just didn't want to share that or she didn't have leakage, so it wasn't brought up. But other than that, I really thought it was awesome. I think these two, Melissa and Michelle, did a great job. Thank you.
Yeah, I agree that they are awesome. Yeah, you know, one thing you can do in a situation like that is if a person says, "Oh, I think it's really embarrassing," we could say something like, "What kinds of things about it are embarrassing?"
Sure.
As a way to sort of prompt the person, but not spoon feed them the language exactly. So thank you for that, Mary. What do other people think?
This is Alex from St. Louis. I am concerned that obviously this was a scripted interview, and I'm concerned that you're going to get I have no experience with interviews such as this one. So, and then if from just the clinical interviews that I have done back in clinic, I know that patients are not as concise and to the point about their answers. And not having any experience, I'm afraid that that the information you're going to get from these interviews is not going to be the quality that that was on this recording.
Well, I mean, I think that remains to be seen, but I mean, we've done this before, and it works already once in Learn One. So I mean, it's true that this was a script, and so real life is not going to be as scripted as nicely. But I think if the interviewer can sort of keep the person on task and try to move the interview along after the information has been captured, I mean, I think it can work. And we do.
Now,
I'd like to
I'm sorry.
can I just add to, this is Catherine. I mean, I think you bring up a great point, and I think obviously with the scripted interview, it didn't take as long as we might expect the real interviews to take. So patients may be a little more rambly or get off topic, and so that's where I think expect that the real interviews will take longer. But the goal is to get that, just to get responses to our actual questions. And so in the rest of the training today, and in when you guys are looking over the guide, I think making sure you feel like you understand the intent of the questions is what's most important, so that then you can be listening when someone's talking, and kind of once you feel like you've heard that, or if they're getting off topic, you can kind of try to direct them back.
Now, in Learn One, we did not do the interview project. I don't know who did, but it wasn't done throughout all sites.
That's right. It was done at just 3 sites. But I think the method is doable, I guess, is what I was kind of alluding to. But just to add to what Catherine said, sometimes what I do if a person is rambling, if I think they've answered my question but they're giving me some additional information, I may say something like, "Oh, thanks. I understand that your leakage really gets in the way of your work. Now I'm going to move on to ask you about some other things," as a way to kind of move the interview along. But it's something that takes some interviewing skill and practice, but that's why we're going to do the role plays. That's why we're going to have the weekly check-in meetings. And it's really no different than being interviewed about anything. Like if you go to see your primary care doctor and they have some questions about what's going on. So there's ways to move things along that that are doable.
Yeah, that's a good point. And actually, I think the other issue to expect is that you'll get patients who don't, have kind of short answers. And so then the challenge with them is to kind of just keep repeating, tell me more about that, or, can you give me an example, or some other ways to kind of get them to say a little bit more. That'll be the other kind of main thing you might run into. But as Jamie just said, when people are talking to a healthcare provider about these issues, there aren't any wrong answers either. So kind of asking the question, hearing what they have to say, probing if you think they might say more if you ask more, but then you can move on. Yeah, hopefully the guide itself will do a good enough job, to kind of get the information that we're looking for. And you can remember, there really aren't any right or wrong answers. We're interested in what these patients are experiencing.
Yeah, so I think that was a good concern to bring up. So thank you for that. Other things that people want to remark on? I'm just going to bring up some discussion points that Melissa and Michelle sort of put together about the role play. So, as Mary picked up on, saying, "Oh, wow, that's a lot." Maybe we don't want to react that way to the participant. There was a couple places where the interviewer asked 2 questions at once. One thing I want to mention about this is if these things will happen as you're doing interviews. So the goal is not necessarily to be perfect 100% every time. It's more to be aware of these things such that you can work on your interviewing style. So if you do interrupt someone by accident, or you do ask 2 or 3 questions in a row, it's not that it like ruins the interview or invalidates it, or it doesn't mean that you're a bad interviewer. It's more just things to be aware of to sort of have a better style to allow the person to answer a little bit more comfortably. So, you know, I just want to put that out there. I mean, I'm a psychologist by training, and I interview people about depression and anxiety and suicide and all these things. And I don't do a perfect interview myself every time, but it's just good to be aware of what a good technique is, so that you can try to bring it into your own style. Let's see. So there was a couple parts where there was some maybe slightly judgmental language. There was some good pausing in the interview, which I think was helpful. There was some commentary by the interviewer. You know, I don't think that there was any egregious mistakes in the interview. So just, you know, just some really kind of minor things to pick up on. So when the person said, "I hope it improved my symptoms," there could have been some additional probes, like what would be an acceptable outcome, or can you tell me more about that? One thing that can be helpful is to sort of check your own understanding of what a person is saying. So if a person describes some phenomena to you, one way to let them know that you're listening to them is to reflect back what they said. And it's also a way to sort of verify that you're on the same page as the interviewee. And so that's one thing that was done in the interview. And then I think Melissa, although, you know, it was scripted, there was some elements that we tried to include of some realism, like, you know, being interrupted by like a child in the house or something else going on. And you know, there's ways to kind of recover from that. So I think what we can do next. So, you know, we've been going for a little bit more than an hour. I don't know if people need a break or not, but what we thought we would do for the rest of the training time is do some role playing together. And then after the training session today, we would ask each of you to sort of run through the interview guides with another coordinator as a way to sort of practice all the questions. And so that way you'll have 2 opportunities to do some role playing before talking with a real patient. So do people need a break?
No?
Okay, well, if people are okay, maybe half of us can stay on this line, and then the DCC set up another go-to meeting. And let me see if I can actually see who we have.
Yeah, so it's in the chat. We have in the chat the information for the other line. And so if we want to try to break this in half, so if the ones from Northwestern Washington University in St. Louis and the University of Washington want to hang up and then dial into or close out and then go into the other line. And then the ones from Duke, U of M, Iowa can stay on this line.
Okay, and I would say maybe we'll do this for, should we say 25 minutes and then come back on this line at 11:35? Would that work? Do you think that would work for you, Catherine?
Yeah, I think that sounds good.
Okay, so we'll each do some role playing separately for 25 minutes, and then everyone will call back into this line that we're on now at 11:35. So for the people who have to switch lines, does everyone know where they're supposed to go?
It's going to be in the chat, right? But I don't see it.
Yeah, I didn't see it.
Can you guys see the chat screen?
I see the chat, but the only thing it says in my chat is "that was awesome" from Mary. And by the way, Mary, I think I need some more inspirational messages from you. So if you could some more chats like that.
It might help if I spelled correctly.
That's okay.
that was.
That's okay.
Okay, I just sent the link again. Are you guys able to see it? It's underneath Mary.
Yeah. And Melissa Sexton, who are the people that are switching lines again?
Northwestern University, Washington University in St. Louis, and then University of Washington.
Okay, so so Catherine is going to stay on this line, and I'm going to switch to this other one.
That's however you guys want to break it up. That's fine.
It doesn't matter to me, Jamie.
Maybe Catherine, if it's okay, just so I don't lose my place and stuff, would you mind switching over to the other one? And
Happy to.
Maybe Melissa Marquez, maybe you could switch as well, and then that way you can kind of help Catherine out.
And everyone has received the guides, right? Those were emailed out right before the call? The guide? Okay, great.
Yeah.
All right, we'll come back around 11:35.
Okay, super. Okay, so let me just pull up the interview guide itself. So because we have a little bit of a smaller group now, can we just run through who we have on the call, just so I know who I'm talking to?
Mary Eno at Iowa.
Thanks, Mary.
Linda Darnick from Michigan.
Hi, Linda.
Hi.
Ashley Chimner, also from Michigan.
Hi, Ashley.
Sarah Richardson from Michigan.
Hi, Sarah.
We have Falayan, Yasmin, and Paige from Duke.
Hello. I'll try to sort of learn and remember people's names as much as I can, but it's always a little bit harder on a video conference or a teleconference. And Michelle, you're still on, is that correct?
Yeah, I'm here.
Okay.
And Jamie, I should share something with you and the rest of the coordinators. I haven't been one to really want to say a whole lot, but they're in the process of hiring 2 people. I have a serious medical illness that I'm battling as of 1st of November. So I'm trying to do whatever I can from home as I can. And so there will be another person doing the interviews, but I think this is something I could do from home if I feel well. And I'm just putting it out there and wanting to know why. I'm kind of hit and miss, especially with my typing.
I can imagine. Well, Mary, we're all thinking of you, and whatever we can do to adapt and support you, just let us know. And so
I always look for new projects, and so the timing was really poor. I love starting new projects, but I know it's been a long road just to get here, and so the timing is bad for me, I should say. But I felt like I should share it with everyone because it's only fair. Because I'll be hopefully talking with you all for many years to come.
Yeah. Well, we hope so as well. And it's very courageous of you to share. And like I said, whatever we can do to support you. I know these things are not easy to deal with, and I've had my share of medical issues in the course of research projects as well.
And some people say don't share it, but I think people will know me better if I do share it. So I think I'm at the point in my life I can say and do whatever I want without fear of retribution.
Yeah, well, whatever you feel comfortable sharing.
So that's that.
Okay. Well, and when the new people are hired, we can go through the training with them as well, and
right. We'll have someone here shortly start training, and we'll probably spend the month of December getting ready to go, and then hopefully first part of January we hit go.
Yeah,
we'll see what all falls into place. There's a lot of things that have to work logistically
I can imagine. I can imagine.
for all of us at all the different sites.
Yeah, yeah. Well, and we appreciate all the complexity that goes into all the research, and especially when we're dealing with other things, and so we want to try to be sensitive to that as much as possible.
Okay. Now I don't want to use any more time.
Well, okay. Well, why don't we, Michelle? I don't know if you would be okay being the one being interviewed, and maybe we could have a volunteer that wants to be the interviewer. And what I thought we would do is we would have the first person go through 2 sections and then kind of rotate. And the only thing I would suggest is when you do the role play, try to sort of talk through any difficulties or mistakes. In other words, try not to break character, because you want to sort of get into the habit of doing the interview as realistically as possible. But we'll obviously have a little time at the end to debrief. So would someone like to volunteer to go first?
I can, because I can get to the right away.
Okay, and I have the interview questions up on the screen as well, and I can kind of scroll down.
I appreciate it, because
or if you want to read it from your own screen, that's also fine. But yeah, why don't you go ahead, Mary, and start us off, and we'll go from there.
And actually, I can't get my interview questions up while this is GoToMeetings on. Last time I tried to do it, I could never get back to the normal screen. So
yeah. Can you see my screen? Yeah, if you can see my screen, I can.
Yep.
I can kind of
This
get
is
it. Great.
I'm going to just start with, does it even mention about the recording? Or are we past that point?
I don't think there was anything on the script for the recording. I just kind of made it up.
So I might use the name Charlotte just for fun, but I will not record that. But Charlotte, I will be interviewing you today about your experiences with urinary urgency. Urinary urgency is defined as a sudden, compelling desire to pass urine, which is difficult to defer. There are no right or wrong answers to these questions. We just want to hear about your thoughts, your opinions, and experiences. To start off, please tell me about your experiences with urinary urgency. This can include your symptoms, concerns you have about your symptoms, or any other things that may affect your daily activities or quality of life. Now I'm reading here.
So I guess my main concerns would be, just having to use the bathroom a lot, and being aware of where bathrooms are at all times. I just, it can be hard just thinking about how often you have to use the bathroom and where to go and things like that.
Okay, can you tell me whether this is urinary frequency or frequency and urgency that you are describing?
I would say a little bit of both. I do have to go quite often, and quite often when I feel like I have to go, even if it's not very frequent, it feels like an emergency all of the time, even if then when I go to the bathroom, it doesn't really feel like that anymore.
So this is off of side note, I'm sorry, but for some of my patients, I would say to them, do you get that initial signal from your brain that says, I better go, and you wait and hold it? Or do you have a sudden desire to go and have to run in emergently?
I think that would be okay, Mary, as a follow-up question.
Okay.
For this first section, I would just always give the person an opportunity to sort of describe it in their own words. And so, I mean, once you've given the person that opportunity, it's really okay to ask whatever follow-up questions you would find helpful.
Okay.
And so, yeah, I mean, I think, you know, given your specialized experience with these patients, I mean, you're probably listening for all kinds of other clinical phenomena that may come up as well. But yeah, but always give them at least one chance to put it in their own words.
Okay. Okay. Thanks for pointing that.
And also as a sidebar, I don't have a lot of experience with these patients, so I'm trying to be creative, but I'm just going off of what I know.
Well, you're being very creative. You've got urgency, girl. Patient to put in their own words. Okay. Can you tell me a little more about your symptoms and how frequent are they during the day?
During the day, I would say that I use the bathroom, 15 or 20 times a day when I actually feel like I have to go. Sometimes, I'll go and not a lot will come out, or I'll leak a little, but then I try to go to the bathroom and, nothing comes out. And so I spend more time in there, but I would say that, I actually go 15 to 20 times a day.
What can you tell me? What if you ignored that signal? What could happen? Anything or?
So sometimes I do try to ignore it, but I'm worried that if I have to go somewhere and my brain is telling me I have to use the bathroom and then I have to go somewhere, that I will have to go once I'm out and then I won't know where the bathroom is. So even if I try to ignore it, I just go anyways because I'm too worried that, there won't be a bathroom wherever I'm going.
Yeah, it sounds like you want to go where you're comfortable with and where the bathroom is.
Yeah, exactly.
Delete that line, Jamie. Okay. I'm just reading here.
But I think it can be good to sort of use some reflection sometimes, because it can be a way to sort of let the person know that you understand what they've said. I guess the one caution would be if you reflect something back that wasn't what the patient meant, then you have a chance a little bit to kind of mislead them or misconstrue something. And so sometimes what I'll do is I'll say, it sounds like you have some concern if you're away from a bathroom. Do I understand that correctly? And if not, please correct me if I'm wrong.
Okay. I like that feedback. So do these sensations happen suddenly or do they develop over time?
I would say they're most often sudden.
And do these sensations come and go or are they constant?
It definitely comes and goes. Sometimes if I have a day where I'm thinking about it a lot, I feel the need to go more.
Is there anything that causes your feelings of anything in particular that you can correlate with these feelings of urgency?
I guess just when I'm nervous, maybe.
Okay. Are you normally an anxious, nervous person, or has your bladder made you one?
Maybe a little bit of both.
So
Okay.
Mary, this is really good so far. So just for the sake of giving some other people an opportunity, why don't we rotate? Who would like to go next? They can start off with this next section. Do we have a volunteer? Was that Yasmin wanting to volunteer?
I seem to be having some sort of feedback. Is it hard to hear me right now?
I can hear you okay.
Okay.
Yeah.
So yeah, I'm willing to
also, one thing I wanted to mention about the interview guide is the questions in italics. Those are like optional questions that may be helpful. So, you can ask them if they're helpful, or if you already have the information, you can skip those.
Okay. So thank you for sharing about the symptoms that you're experiencing. So next, I would like to just ask a little bit more about the history of your symptoms. So what was the first symptom that you experienced?
Probably how often I have to go to the bathroom, just using the bathroom more than I usually do.
Okay. Tell me more about that.
There was just a point in time where I realized that I'm probably like doubling or tripling the amount of times I would go to the bathroom, than just like previously I used to have to.
Okay. And what about your other symptoms? When did they begin?
Kind of one right after another. I'm not sure which ones came first after or like when they all started, because I couldn't really tell until I started going more frequently.
Okay. And can you remember a time when you did not have your urgency and your symptoms?
I'm sure there was a time, but I can't remember off the top of my head. I've always been kind of nervous. And, when I was younger, my mom would always tell us to use the bathroom before leaving. And I think some of it's kind of built in, and then it just kind of escalated from there.
Okay. And what symptoms bother you the most of the symptoms that you're experiencing?
I would say what bothers me the most is, just how often I have to get up to go to the bathroom.
Okay. And how frequent would you say those symptoms are?
Probably like 15 to 20 times during the day, and then, at least 3 or 4 times during the night, which I guess actually that one bothers me the most, is just having to get up from sleeping to use the bathroom.
And having to go to the bathroom so frequently, how would you say that interferes with your life? Or does it interfere with your life?
It does interfere with my life. It's just not always fun to have to go so frequently. People might ask like why I'm going so frequently, and I don't always want to tell people, and just not really feeling like I'm able to relax all of the time.
Okay.
Okay, I just want to interject for a moment so we can give someone else a chance, but I want to say, Yasmin, you did a lot of things that I really liked. You have a really nice natural conversational style, which I think is good. And that will become easier for everyone as you begin to do the interviews, because you'll sort of know the questions a little bit more, so you won't have to read every line as carefully. I also really liked how at the end you reflected back to her what she said. So she had said, well, it's really the frequency that bothers me. And you said, oh, how does that frequency interfere with your life? And so it was a good way to sort of use what the person told you and weave it into your questions. So I thought that was really good.
Thank you.
So who else would like to volunteer? Do we have some other interviewers on the line? Maybe not. Also, Mary,
I
do you?
think someone's gonna. We have
Hi.
Foylan.
Yeah, I can do it.
Okay, sorry. Okay,
It's okay.
Foylan, yeah, if you want to start off from section 4.
Okay. So, how do your symptoms change over time? How would you say that they change?
I'm not sure that the symptoms have changed, but I have noticed that I respond to them more. I think, going back to what you said earlier about ignoring them, I think I used to do that more, and now I just don't feel like I can.
Okay. And what things or other issues or concerns might make your symptoms worse?
So I have some other medical conditions, and so my other physicians are always recommending that I drink a lot of water, like a lot more water than I normally would, and obviously that makes me have to go to the bathroom more. So that's a concern of mine, is trying to balance this issue with my other medical issues.
Mm-hmm. And what things make your symptoms better?
There are days where I just won't think about it as often as other days, and just kind of not, I don't want to say less aware, but I guess just when I'm not thinking about it so much, they don't seem as bad.
Okay. Are there certain foods that affect your symptoms?
I guess when I eat more like liquid-based things, so like soups or something like that.
And what about beverages? Are there certain beverages that affect your symptoms? And how do you think these foods or beverages affect your symptoms?
I think anything with liquid is my biggest concern. I just try to limit it as much as possible.
Okay. And do you drink any caffeine or alcohol?
Yes, both.
Okay. So, regarding any anxiety or stressful events, how does your urgency affect you emotionally? Does it cause you stress or anxiety?
Yeah, I think it does cause me more stress and anxiety. I think that I've always had, been prone to experiencing stress more than others, and this just kind of adds to that.
So, what goes through your mind when you feel urge or urgency?
Um, I'm not sure that I understand the question. I don't think I give a lot of time to think about it. I just go to the bathroom
Okay.
as quickly as possible.
Okay. So, you don't have thoughts that are particular to your feelings of urgency or urge that affect you in any way?
Um, I guess if I know that I have like a meeting coming up, one of my main thoughts is I have to go to the bathroom before this meeting so that I don't have to leave during it. And there are times when I do try to avoid going to the bathroom for a little while just to make sure it's a real urge to go. But other than that, yeah, I don't really think about it too much.
And does your urge or urgency cause you to worry?
Yeah, mostly that I just won't have a bathroom nearby when I need it, or I won't get there in time and I might, leak or something.
Okay. So, how do you cope emotionally with urge and urgency? Do you ever avoid anything because of it?
I mean, I really just cope by using the bathroom more. That way I feel, it makes me feel better knowing that I have just gone. And that way, if I do feel like I have to go again, I can remind myself, well, you just went 10 minutes ago, so you don't really have to go again yet.
Okay. Did anything happen to you before you first started having urgency, like any form of abuse or neglect as a child?
Not that I can remember.
Okay. Has anything ever happened to you that was extremely upsetting or traumatic, like a serious accident or some type of physical or sexual assault?
Oh, now that you say that, I did get into a really bad car accident when I was maybe like 8 or 9 years old.
Okay. And how did this affect your urinary symptoms?
Um, I don't know if it has, but it has made me more worrisome about, being in cars or, just going places in general.
Okay.
Okay, so let's pause to give someone else a chance. But Foley, and I think you did a really nice job as well. And you had some tougher questions that came up, but you did a nice job, weaving in some of the follow-up questions. And so I thought that you also had a nice style. One thing I wanted to mention about this question about whether anything happened. I think for this question in particular, it can be good to just state the question as is, and then depending on what the person says, to sort of ask some of the follow-up questions, because the person may volunteer that something happened.
Mm-hmm.
And if they do volunteer something, then you can sort of follow up with it. And if if they don't understand the question or they need some prompting, you can use some of the additional questions.
What if they don't want to discuss that issue or talk about it? You know how some people don't want to relive.
Yeah, I wouldn't push them for the purposes of this interview.
Mm-hmm.
You could say something like, for this interview, we just want to know whether these things affected your urinary or bladder symptoms. And so if that's something you can tell me about, that's okay. But if not, we can move on.
Okay.
And so I would always stay at the person's comfort level. And if you sense that the person has some discomfort talking about it, you might even say, would it be okay if I asked you some questions about how this may have affected your bladder symptoms?
Mm-hmm. Okay.
This is Catherine. So hi, we're back. I actually just have one question about that though, Jamie. I don't know that we should expect them to know how those things did or didn't affect their bladder symptoms. I don't know that people necessarily link those things.
Yeah, that's a good point. They might not, and it's sort of this distinction between like a link that we can identify in research, like with longitudinal analyses or correlational analyses, versus a link that the person thinks exists.
Yeah.
I think part of the motivation for including this particular question was we're also asking the ACE questionnaire as part of LURN 2, which is about like past childhood neglect and trauma and stressful events. And so I think the thinking was this would be a way to get some qualitative data to accompany that. Yeah, so I don't know if there's a better way we should word that, or maybe just strike it.
Yeah, no, I think it's okay to maybe we just remind the person that they don't need to answer. I mean, at the beginning, I actually didn't see it. I didn't look again at like the consent part, but just reminding people at the beginning of the interview that that they're welcome to skip any question they don't want to answer. And then I think, just for any topic, asking questions that might be upsetting to someone, just sort of asking it in a, a professional way, and I think in a confident way too, to kind of try to put the person at ease, and also, making sure that so that it doesn't sound like you're uncomfortable.
Yeah. Well, so a couple of things about this question. I mean, I think this question is probably the most evocative of all the questions in the interview guide, and it's important that we are all on the same page about, we're not trying to get a lifetime history of all the person's traumas, whether they be assaults or accidents. We're more wanting to know whether something happened right before their problems with urgency began. And so I think when we ask the follow-up questions, we should sort of anchor it in that way. And so, I mean, we're going to have to sort of tailor the questions based on how the conversation goes. But so if I were interviewing Michelle or Charlotte, whatever we were calling her in this case, I might say, oh, so you said that your urgency began a long time ago. Did anything happen to you before that first began? And if she says, well, yeah, I mean, it began like, in childhood, we might say, well, before this began in childhood, were you ever abused by anyone or neglected? And then, if necessary, to ask, before your urgency began, did anything upsetting or traumatic happen to you, like being in a serious accident or being physically or sexually assaulted? Just so everyone knows, the wording of this question is very similar to the wording in the SCID, or the Structured Clinical Interview for DSM-5. And this is the way that they prompt for traumatic events. And I mean, the wording, it can work. And if a person is uncomfortable, they can feel free to skip it, or if we sense that they're uncomfortable, we can ask them if it's okay for us to talk about it a little bit more. Does that make sense to everyone?
It makes sense to me.
Okay. Okay. So how did your role plays go, Catherine?
They went great. We just had two people who could participate in that. We had one of our participants doesn't have a microphone, so we'll have to get those make sure we have the technical issues worked out for everyone if we're using Zoom and someone needs to use the phone, how that's going to work with recording and things. So that seems like one thing to put on the follow-up list that we found. But I think for me, one thing listening to a more kind of off the cuff interview that I noticed that I'd like to talk about a little bit is we have quite a few questions that ask about time and things, how they change over time. And what's, I think, a little bit vague in the interview guide, and wanted to understand if this is intentional or not, or how we should think about this as a group, is when we talk about how things have changed over time. Do we mean that kind of like over the day or over each period of time within the day that you're urinating, and then developing, as more urine builds up, you might have then a feeling of urgency? So do we mean like that kind of time, or do we mean like over the past 50 years of someone's life? So it seemed to me like there were times where the interviewer would say something and I was interpreting what they meant as, like, is it constant or does it change over time? That meant like, multiple times in the day, as opposed to, do you always have this, or has it changed over the past 20 years? So I just wondered if, Jamie, you had thoughts about that, or if we could just talk about that so the whole group of interviewers can think about that a little bit.
Yeah, I mean, that's a great question. I don't know if I have a straight answer, because I think both could potentially be interesting. I think the way that I would handle this is to sort of see what the person says in response to the questions and then probe about it further. I mean, really what we're trying to do in the first, well, I mean, if we look at the way that the sections are named, that gives us a sense of what the goal is of that section. So, describing the symptoms, the onset of the symptoms, bother, and so on. And so I think for some people, the course of their symptoms may be relevant, where they talk about the symptoms, worsening with age, or worsening after a different procedure, or some kind of medical illness worsening. But for some people, they may have some sensations that they feel as their bladder is filling. And so I think that, like, this question here, I think that's what that's intending to get at. And this is one of the optional questions, and so that that may or may not be relevant to every person. So I don't know. I mean, I don't think that there's one very specific question about time that we're trying to answer. I guess I would say, in general, we want to know something about how the symptoms onset and what kinds of a change the person noticed from before they had the illness to after it developed. But indeed, the symptoms may have a temporal quality to them as well, like they're worse at night, for example. So I don't know if that's a good answer, Catherine.
Yeah, I mean, I think it is a good answer. And I think, yeah, just trying to be attuned to how people are talking about time, so that if it's unclear, you can kind of clarify that in the moment, because, there are multiple steps from when you're in the interview with someone to what we analyze, because, we go to the recording and then to a written transcript. And so, kind of meaning can get a little bit degraded at each of those steps. And so when we're then analyzing a written transcript, you know, I think we don't have more information about what the person meant because we're not hearing their voice, and so, you know, I think that to me just seemed like something that would be great to just make sure, you know, you're kind of listening for and can clarify in the moment with someone about how they're using that word.
Yeah, indeed. Yeah, I guess one overall suggestion I would have for people is as they do the practice role play as well as, you know, the real interviews is to take a look at the section header and just have in your mind, you know, what it is you're trying to get information about, because that may help to shape some of the questions as well. But yeah, I mean, I think in terms of the timing, it may manifest differently for different people. I know that we kind of we're talking about you know, different ways that urinary urgency can manifest. I'll just share with the group. I've had some issues with urinary urgency myself. I was born with what's called a UPJ obstruction, where your ureter attaches to your kidney. And so since then, I had a nephrectomy about 10 or 15 years ago. But it was like misdiagnosed my whole life. And the way that I would experience it would be, I would have this like sudden urge to go to the bathroom that just seemed to come out of nowhere. It would go from like, you know, zero urgency to like intense urgency right away. Now, I didn't have, you know, overactive bladder disorder or UUI. I had a different condition, but I mean, there's different ways that these symptoms can be experienced. And so, you know, just hearing about how it goes for our patients may be helpful. And I think among people with overactive bladder, I think it can vary. I think for some people it can sort of build over time, and for some people it can be sort of immediate.
Yeah, I think that's useful to think about with someone, you know, who may be struggling to come up with describing what their experience is, because they may think that their experience is the same for others. And so just, you know, reminding people, like, you know, we use the word urgency, but people can experience that in different ways. And so, you know, we want to hear about kind of what that specifically looks like for you and what those feelings are.
Yeah, I think some people may use words like pain or pressure or discomfort or fullness. And, you know, it's hard to know what someone else feels like, but the best we can do is sort of listen to the kinds of language people use to describe these phenomena. Yeah, I think in our group, I think all the people that did some role plays did a great job. It seems like the interview guide was easy to follow. The thing that I would recommend that people do is just, you know, again, to sort of run through a role play of this, a complete role play with another coordinator, and, you know, just keep in mind that the questions that are in like normal typeface are the ones that are intended for you to read if necessary, and then the ones that are in italics are kind of suggestions if you need to follow up. And I would definitely follow up with each person a little bit within each section until you have a little bit of a description of, you know, what's going on. So like in section 2, we're trying to understand what it was like when the symptoms onset. In section 3, we're trying to understand, you know, how bothered they are. And, you know, we know that some of the clinicians in LURN are interested in this idea of like a person's chief complaint or what bothers them the most. But I think everyone did a great job. And then, you know, the last section, which, you know, we actually didn't really role play too much, was about, you know, treatment expectations. Where, you know, we're really wanting to hear from the patient what it is they're hoping to get out of the treatment, like, you know, what their goals are, what they think is going to happen, and so on.
Yeah, and actually, I want to interject right there too. I think that is a section of the interview that is the interview guide that is one of the more novel parts, and so It's at the end because it seemed to make more sense kind of in the flow of things to talk about it at the end. But I think keeping track of time will be important so that you don't run out of time before you get to this section, because this is a really important one, especially for the longitudinal nature of these interviews. You know, we're definitely going to be linking what they tell us here to what they tell us later on after they've had treatment.
Yeah, I agree. I think this is going to be really novel. And I mean, there is some work that exists on treatment expectations, you know, in general, although I think a lot of it tends to be survey based. And so maybe you know, Catherine, better than me, but I don't know that there's a lot of like mixed methods research on treatment expectations. And so
Yeah, I don't think so. And certainly not in urgency specifically. So
yeah. Well, so let's talk about some homework assignments. So everyone has the interview guide. We also distributed a little rating sheet that you can use if you're the person being interviewed or you're being observed to kind of give the person feedback. This is really just a way to sort of help the person conducting the interview so that you can give them some feedback, and you know, you don't have to stick to it in some kind of ironclad way, but it's just a way for an observer to help to sort of take some notes. I think everyone who did some role playing today, I think did a great job. So what we would suggest as a homework assignment is that each person who's going to be an interviewer to run through the interview guide for both the pre-test and the post-treatment interview guide with another coordinator to just kind of practice like saying all the questions. And that way, when it comes time to do it with a live person, it'll feel more natural. If anyone wants to do some additional role playing with myself or Catherine, you know, we're definitely open to it, and you know, we're happy to set up some times with everyone. And Catherine or myself will sort of listen in or listen to a recording rather of each person's first interview as a way to give people some feedback as well. For other people doing the interviews, I hope this is going to be an interesting experience as well. It's kind of a nice skill to have, to be able to do these kinds of interviews, and I think the patients really do appreciate having a chance to kind of tell us directly, you know, what's going on, and it's a way for us to show them that we're really interested in hearing from them. So does everyone understand what they're supposed to do as a homework assignment? I'll take the silence as a yes. Does anyone have any questions that they want to ask or put into the chat, or any other concerns that they want to raise? And I just want to say, if there are any concerns, you know, I really want to address them. You know, if there's anything that we think is going to be difficult or we think it's going to go wrong, sometimes we don't know until we get going, but you know, we really do want to make this as effective as possible.
Jamie, this is Mary. Aren't there additional online questionnaires they're supposed to do, or are those in paper form? And
there are additional questionnaires that the person is doing, but that I think is just linked to the observational cohort study.
Okay. So you would have those questionnaires whether they were in your study or not.
Yeah. So this is basically like layered on top of the observational cohort study.
Okay.
Yeah. So the only thing that we really need to do for Project E is really just the interview.
Okay. And then you reschedule another one approximately 3 months at their 3-month visit?
That's right. I have to check the protocol to see exactly what the time window is, because I don't want to misspeak, but it's in the protocol.
I think it's pretty flexible. It
Yeah.
looks like, I want to say 30 or 60 days maybe.
And we made it flexible on purpose, so that way, you know, it'll be more logistically feasible.
and also potentially dependent on the treatment, right?
Right.
Yeah.
Surgery or not.
Right.
Yeah. when we chose the interview, when we chose the interval, as well as when we discussed the timing of the observational cohort study, I mean, we did look carefully at different options, including looking at what was done like in clinical trials to see what kind of follow-ups they use. And so I think whatever follow-ups are in the protocol, should be kind of sensible, where the patients should have some idea of, what's changed. But if not, we'll learn something from the interview either way. And there are going to be some patients who maybe don't get better for whatever reason. And, it's going to be helpful for us to know that as well. Any other questions or comments? Well, I just want to thank everyone for actively participating. And if anyone has anything that they want to communicate offline, you can send it to me or Catherine or both. I want to give everyone a word of confidence that we did a similar kind of study in LURN 1 that worked out okay. I mean, there's always some issues with putting these things together and getting some practice in, but this should be sort of a doable method. And if there is anything that comes up that's difficult, we can talk about it and try to resolve it. But thanks everyone. I thought everyone's questions and comments today were great, and so just thanks everyone for participating, and we'll go from there.
Thank you, Northwestern.
No, thank you, and thank everyone. Yeah, an extra special thanks to